Importance of Bonica's management of pain, history of pain concepts and therapy. Approximately 25% of people in the U.S. are affected by chronic pain. Chronic pain affects and takes over a person's life to the point where many are unable to live normal lives and participate in activities many of us take for granted. Euthanasia. My main claim is that euthanasia alleviates pain and suffering. The definition of euthanasia, according to the New Oxford American Dictionary, is the painless killing of patients suffering from incurable and painful disease or an irreversible coma. My first supporting claim is people in the U.S. live with pain. Like I mentioned before, 25% of the people in the United States live with chronic pain, but 50% of those people are cancer patients. Living with pain is a hassle, and according to the American Chronic Pain Association, the 2004 Americans Living with Pain Survey, in the U.S., more than 2/3 of chronic pain sufferers experience more than 3 years of chronic pain, and 76% experience pain daily. 1/3 of those whose pain is present say pain is very severe. 59% of those people in the United States with persistent pain say that it's not under control. Cancer is the leading cause of pain in the U.S. According to the Centers of Disease Control and Prevention, the number of people living with cancer, in 2006, approximately 29 million men were diagnosed with either prostate, lung, or colon cancer, and 21.5 million women were diagnosed with breast, lung, or colon cancer. Painkillers were more than often prescribed to alleviate this pain, but painkillers don't always work. Side effects, according to Wiseman's method, advanced treatment for opiate dependence, prescription painkillers include Vicodin, Percocet, Oxycontin, and so on, are widely prescribed in the U.S. to treat moderate to severe pain. The opiate blocks pain signals by attaching opiate receptors located in various parts of the body and brain. Prescription painkillers are effective treatment for chronic pain or persistent pain and can be taken safely. The downside is that they can also cause physical and psychological dependence. Side effects of these narcotics vary widely depending on some more common than others. They can be mild, but they can also be severe. Some can include constipation, swelling and cramping, weight loss, decreased appetite, even with short-term use, patients can experience one or more of these side effects. They can also include sedation, euphoria, dizziness, fatigue, depression, tremors, sleeplessness, and various other side effects. Sorry. Taking too much of an opiate medication can also be fatal. More serious side effects can include severe respiratory depression, confusion or stupor, coma, clammy skin, circulatory, and cardiac arrest. Misuse of painkillers can lead to, according to the Center of Disease Control and Prevention, are often abused. These drugs are widely misused and abused. 1 in 20 people in the United States, ages 12 and older, use prescription painkillers non-medically, without prescription. Euthanasia is a more effective way to alleviating pain and suffering. Euthanasia is already legal in some states, Oregon and Washington are some. No, the number of people who have used the prescription of euthanasia in Oregon, according to the Oregon's Death with Dignity Act. In 2010, since the law was passed in 1997, 525 patients have died from ingesting medications prescribed, proving that if passed, euthanasia is a method used to alleviate pain and suffering. I am not here to argue that euthanasia gives death with honor, or that death should be a choice because it's our bodies. I am here to show you that chronic pain is very much a part of people's lives today. And my main claim is that euthanasia alleviates that pain and suffering and is needed by many in the U.S. as an option for that very same reason.
All right, you identify the proposition. It sounds quite broad, though. I like the statistic you have at the beginning, but if what your number is correct, that 25% are suffering from chronic pain, and you're saying euthanasia is the effective alternative on this, man, that sounds like you're saying that we ought to be snuffing 75 million people, and that seems like an awful lot, you know. And then you've got a whole bunch of other numbers that come up in the body of the speech, and going through all those things, whoever the respondent is ought to be paying attention to that, because it really feels like if I took all these numbers that you're talking about and treated them according to the standard that you're talking about, we really would be talking about not 500 people over 10 years in Oregon that have taken their life, but something like you're saying, suggesting that millions of people ought to be using this as a way to relieve their pain. And I'm not sure that that's going to be as saleable as some of the other arguments that you're making. You need a much clearer structure in the body of the speech. I could see that there's a way of thinking that you're trying to build this together, but it needs to be clearer so that we can follow it and not make the inference that I was just talking about, which I think a lot of people could jump to that particular conclusion. Like I said, it seemed like there was a data dump on the numbers, so there's a lot of information there, but you need to help us figure out how we're supposed to be making inferences with those numbers. All right, thank you.